I want to welcome everybody here. It is so great to see so many people out there, a lot of bright new faces, and hopefully some folks that may be entertaining becoming a new member at some point in the near future. So if that's the case, I know somebody said earlier to see Diana. Diana's not here. So see Sharon Barhorse, because she is our new membership chair, and she will be tickled pink to have you come talk to her. I have the pleasure of introducing some of our guests today, so if you'll please stand and as we give you a warm Kiwanis welcome. First is Mr. Ray Shaberg. Anybody want to guess to whom he is related? Also, Jennifer Lauer. Hey, Jennifer. Where's Jennifer? Okay. And Olivia Hall. Both of them are from IMG, and Ed Cleveland and Brett invited them to come today. Also, Tom Waters. Tom? From Easter Seals, you met him earlier, and thank you so much for having those kids come up. That was great. And also George Pfeiffer. Where is George? All right. So thank you all for coming, and I hope that you enjoy the rest of your meal and our guest speaker for today. Thank you.
Next up, Tom Mosley will bring us our video of the week.
Okay, this is to get in the spirit of the Christmas season. This is a girl that's skeptical about Santa. So
I'm supposed to meet Santa at the mall. You mean Santa, the dude Mom mentions? To Mom looking at me. Yeah, peeps, we know the deal. This ain't my first rodeo. He knows when I'm sleeping. He knows when I'm awake. First off, this guy has no life. And, that's really creepy. Better not show, better not cry. This guy's standards way too high. Oh, and who do I trust to buy me the latest toys? An old man living in the North Pole. Right. Let's point out the obvious guys. He breaks into your house at night. I think it'd be safer if your parents just drew the stockings. Speaking of stockings, can you just run Christmas like it's a birthday party? What's even the deal with Santa Claus? Santa, if you're watching, no offense.
Well, good afternoon. It's my pleasure to introduce a friend of mine. Her name is Melissa Larkin. She is the Chief Executive Officer of Centerstone of Florida, a $35 million nonprofit behavioral health organization for Southwest Florida, and they've been around for the past 62 years. Melissa has a master's degree in business administration and a master's degree in counseling. She is a licensed mental health counselor with nearly 25 years of experience providing services in all aspects of behavioral health. Melissa previously was the Chief Clinical Officer and the Vice President of Inpatient and Residential Services. She has operated diverse programs serving children, adults of all ages and levels of care, including inpatient, residential prevention, outpatient, crisis intervention, community-based, and child welfare. If you would please give a warm Kiwanis welcome to Melissa Larkin-Skinner.
So when Brett asked me to speak, he didn't tell me I would be following the Easter Seals family singers and a cute little girl talking about Santa Claus. I might have said, no, I don't think so. Do you have another date? Unfortunately, I'm here to talk about a subject that hits close to home and that I've been talking about really for about 2.5 years. And as I was sitting here, I remembered the first time I actually spoke in public about the opioid epidemic hitting us here in Manatee County was in this very room. It was actually in front of a Tiger Bay audience. So I'm gonna give you a little bit of history about the epidemic and kind of where we've come today. Let's see here. So first I want to tell you what opioids are. They're primarily used to treat pain. You know, pain is a real thing. It's a very subjective experience. Everybody experiences pain in a different way. These medications were developed by pharmaceutical companies to try to help people not have to suffer due to pain. And so you can see some of the names of them. We put the chemical name as well as some of the brand names. So back in the good old days, in 1990, really before 1995, opioids, this class of drugs, were rarely prescribed. They were really only prescribed for cancer and for other terminal illnesses. They were dispensed primarily by specialists rather than primary care physicians. So fast forward 2 decades later, and in the United States, we're prescribing 254 million prescriptions every year. It amounts to $11 billion in revenue and is costing us $72.5 billion due to the non-medical use of these prescription drugs. So how many is that? That's enough for every single American adult to have a month's supply around the clock. So as you can see, some things converged that really caused this, what has become a train wreck for our society. One of the things that changed is specifically the Purdue Pharmaceutical Company started marketing. They developed a drug called OxyContin. It's an opioid. And they said, oh, it's non-addictive. There's less than a 1% chance that you'll become addicted, that anyone will become addicted to OxyContin. They marketed it not just to specialists to treat cancer and the pain caused by cancer and terminal illnesses. They marketed it as an answer for all kinds of pain, migraines, surgery, anything after surgery, or ongoing chronic pain, which is also a real thing. It was a huge industry and sadly remains a huge industry for them. And Purdue Pharma not only produces OxyContin, they probably produce 5 or 6 others on that list of opioids that I just showed. It is a big business for them. The federal government sued them for false marketing practices when they figured out that, in fact, Purdue knew that these drugs were addictive, highly, highly addictive, because they were saying they weren't. And so they had to pay a $635 million fine. And can you imagine that? And it didn't hurt them at all. They continue to produce these drugs today. One of the things that's happening recently, the last bullet point here, is that many states are filing lawsuits. Kentucky is one of them. I believe Florida's starting to talk about it. Virginia. They all are going to sue or have filed lawsuits against Purdue Pharmaceuticals because they believe Purdue really opened the door and started this epidemic. Another thing about pain, and this is really talking about the unintended consequences. So I already mentioned that pain is a very subjective experience. It's different for everyone. We all have a different level of pain tolerance. So what happened is that we decided, and rightly so, people shouldn't have to suffer. We don't want anyone to suffer, right? So what do we do about it? And as Americans, one of the things that we do is work and work and work and work and work, and we like to work, and we want to go to work, and no matter what kind of pain we're in, we still want to keep working. And a lot of times we have to keep working because we have to support our families and ourselves. And we also believed there has to be an answer. And my doctor, we all trust our doctors. My doctor can fix this. And we've kind of gotten in this loop of there's a pill for everything, right? There's a pill that can fix anything and everything. Unfortunately, that's not true. but we kind of believe it to a certain extent. And because we trust our doctors, we don't believe they're going to give us anything that will hurt us. And that was not their intent. And we know that. So pain in American medicine, there's a company called the Joint Commission. The Joint Commission accredits hospitals. And one of the things, and I remember this very clearly because of the fact that we run a hospital, one of the things they were very focused on 20 years ago was pain, and making sure that when people were in pain in any hospital, that we measured that pain, and then we provided treatment for that pain. And still today, we have to go back and say, okay, did the treatment work? And I don't know if any of you have ever been to the doctor in a hospital and they give you this row of smiley faces. It starts with a big smile with a 0 pain level and goes all the way sometimes to 10 with a very sad face that's red for a pain level of 10. So we started using that 20 years ago to determine what is the pain level, and then we go back and we measure it periodically. And every time somebody's pain level rose, we would treat that pain again to try to alleviate their suffering. And one of the things, unfortunately, we don't always do in the medical field is ask people about a family history of addiction. Part of it is, I think, historically, we haven't always known, 30, 40, 50 years ago, people hid their family secrets. Addiction was one of those secrets. It still tends to be today, although that is getting a little bit better. And so even if they did ask, we wouldn't necessarily have known back then. So things are we're a bit more knowledgeable today, and it's really, really important that if you ever go to the doctor and they ask you about a family history of addiction, and there is one, that you say yes because of this issue. So politics enters into this as well. The FDA obviously approved the opioids, or we wouldn't have been able to get them. They wouldn't have been able to be prescribed. And they approved them for the uses that they're being used for today. It's a billion-dollar industry, multi-billion-dollar. I should have put lots of dollar signs there. Another thing that we saw in this time frame, the last 10, 20 years, is really a reduction in law enforcement budgets across the country. Policy takes time and money, and all of us advocating to get any kind of change. So just to give you an example, we've been talking about this problem since 2014, is because that's really when we noticed it here in our community. And the Florida legislature hasn't really enacted any policies until the last year. So hopefully you can see this. I included it because I wanted you to see a national picture. So nationally at this point, there's 64,000 people every year dying because of opioids. 100 people daily, 100 Americans daily die from opioids. In Florida, that number is 14 people every single day. And that has steadily risen. Back in the middle of the pill mill epidemic in about 2010, that number was 7 and then went to 9, and then we saw a little bit of a drop. And now this is all opioids, and we're at 14 every single day. And then Florida, most notably, unfortunately, has the highest number of deaths. And one of the things that you'll see on this little map in that circle is Manatee County. And Manatee County is the darkest county on that map, which indicates that we have the biggest problem in Florida. And this was last year, 2015. And then on the left-hand side, what you'll see is 2015 representation of how many people there are dying from opioids monthly in the United States. And the thing that's most striking about all of these graphs that I will show you is that you kind of see it steady for a while and then they all shoot up like this. That's how fast this has come around on us. So Florida, 2009, 2010, was very clearly identified as the epicenter of the pain pill problem in the United States. And I couldn't find the graph, but I remember seeing back then this graph that it was sideways bars, and it showed Florida and the number of prescriptions for opioids, and it went all the way to here. And every other state was over here. So Florida was not only supplying Floridians with pain pills, we were supplying the rest of the United States. And it very much upset states like Kentucky and Virginia and West Virginia. So in 2009, there were more pill mills in Broward County than there were McDonald's. Today, we might look at that and say more Starbucks, because there seems to be a lot more Starbucks than anything in big cities. And a doctor working in these pain pill mills could make up to $2 million a year. And it was all cash, by the way, all cash. So this is a map of deaths caused by prescription opioids. 3 specific ones: methadone, oxycodone, and hydrocodone. Those are the chemical names. And as you can see, that spike occurred. It was climbing, occurred in 2010, dipped way down as we've been in this heroin, fentanyl, all other opioid epidemic. And now it's picking up a little bit in 2016. And then there's a drug called fentanyl. Fentanyl is actually produced, unlike heroin, it's actually produced for medical purposes. It's usually produced in a patch, and it's for people with very severe chronic pain, terminal illnesses like cancer, to try to alleviate people's suffering. Unfortunately, what has happened is there are chemicals that people can buy over the internet from countries like China, as well as supplies coming in from Mexico, that people get their hands on, drug cartels, and they're making fentanyl in clandestine laboratories. That's the fentanyl that we're seeing on the streets, not the fentanyl produced by pharmaceutical companies for legitimate treatment. Unfortunately, why we saw so many deaths and so fast is that fentanyl is much stronger than pain pills, than the pills. And you can see this heroin as well, and one of the things that happened in Manatee County specifically is we went from pain pills, we saw a little bit of a lull, we started to see heroin spike. And then heroin's come down, but fentanyl and what we call fentanyl analogs has spiked tremendously. One of those drugs is carfentanil, which you may or may not have heard about if you read the newspaper articles about this subject. One of the things that's scaring me right now, and we're seeing this at Centerstone, is cocaine is rearing its ugly head. And as you can see, and actually last year as well as this year, Manatee County is very high in deaths caused by cocaine as well. Last year we were the highest. This year we're high, but there are 5 or 6 other counties that are high as well. And one of my staff told me she's pretty sure that some of what is happening is people believe they're buying heroin, and what they're getting is cocaine, or it has cocaine in it, and it can be dangerous too. So I thought this slide was interesting. What this actually lists is a variety, like the top drugs found in people who have passed away. And for instance, the 4th one that you see there, that's cocaine, and it's around 1,700, 1,800 deaths, which is a huge increase from last year. This is 2016. The green is 2016. So what I do is I put a square around those opioids, because all of those on the end there are opioids. So Florida has seen 4,978 deaths to the traditional opioids, as well as another 1,026 for fentanyl analogs. And what an analog is it's a drug that is chemically very similar to fentanyl, but they change just a little thing. And so they call those analogs, and that's what carfentanil is. Carfentanil is thousands of times stronger than fentanyl, which is 50 times stronger than heroin. So this is the fentanyl analog deaths. And you can kind of see where we are. I mean, kind of see, you can see. We're the only red state, or a county, red county, sorry about that. And then you can see cocaine. I was mentioning earlier that we were #1 last year. This year, we have some company, unfortunately. So 2014, that's the year we kind of noticed a spike. It was actually in November of that year that we really saw a huge spike and said, what the heck's going on? And so what we saw that year was 51 deaths due to fentanyl, 48 to heroin, 51 to cocaine, 88 to prescription opioids. And then you see 2016, which is last year. And you can see how that has changed for the worse. So while fentanyl's not as many and heroin's not as many, the fentanyl analogs have gone through the roof. Part of that is that carfentanil, even if it just gets on your skin, if you think of it like a grain of salt or sand, you can die. It kicks you into respiratory failure. And so it's harder to be able to respond to people from a drug that takes effect that quickly, to get there in time to use Narcan to save their lives. So Manatee County Emergency Services, this is kind of where we started to notice that November 2014 jump. We had a 1,500% increase from July 2014 to July 2015. And the next bit of information is just, I thought it was interesting. For some reason, it always seems to spike in the summer. For a while, it was July, as you can see, 729 Narcan doses. Narcan is a drug that we give people to reverse an overdose. It's an amazing life-saving drug. You give it to them, and they snap out of that overdose like that. If they haven't taken a bunch of it, or it hasn't been going on for a little while. Sometimes we have to give them 2, 3, 4 doses. Most of the time it's 1, but there are people that even take 8 doses. And that just tells you how suppressed their immune system is, or not their immune system, the respiratory system is. So 2017, we've seen a little bit of a decrease, but not much. And so far, the stats that I had went through June, and we had 432 doses in June. This fight is far from over with that kind of number. And this just gives you a little bit idea of how many doses our EMS folks have been having to administer. And one of the things I want you to take note of is 729 doses in July. Divide that by 31. How many is that in a day? That's huge. That's what our poor first responders are responding to constantly, law enforcement and EMS and our firemen. So this is the cost, along with the total number of doses. And even though I don't have the 2017 numbers, it's probably going to be around similar to 2016. And this is the impact that it's had on our child welfare. I did work in child welfare for a while. It's the hardest job on the planet, in my opinion. No offense to anyone that does anything else, but it's very, very difficult because it's hard to fathom why kids are neglected and abused, right? Why we can never seem to end that. So what the results were of the heroin epidemic, or it originally started as a heroin epidemic, and then we quickly changed to opioid epidemic, is that we're at 2 times the statewide removal. Right now, today, Sarasota County is actually first in removals of kids from their families. We are second still, but we were first for a good 2 years going. The Safe Children Coalition went from having 900 kids in care to 1,600. That's more than we had when we first privatized child welfare, at least that I can remember, and I was there. And then out-of-home costs are in excess of $7 million. Our child welfare organization is costing them $10 million more a year to run their program than what they're being paid. So this is gives you an idea of what we've been doing locally to try to combat this opioid epidemic. We have a lot of community collaborations with the Sheriff's Department, our police departments, Manatee County government, emergency medical services, obviously. We have a new program called Community Paramedicine that does a lot of outreach for folks that have overdosed and ended up in the ER. The hospitals, the Safe Children Coalition, as well as Lake Erie College of Osteopathic Medicine, and our local prevention coalition, Drug Free Manatee. Some of the things that we've done is applied for grants to try to bring more money into the community. Uh-oh. Does that mean I'm out of time, Brett? Okay. All right. So just drug disposal sites, we have those at our local law enforcement agencies to go. People can dump their pills in those, they're like little machines, boxes. We have Narcan for first responders. Our police and sheriff very much believe in we can't arrest our way out of it. We need to get people to treatment. And we're providing addiction services in the jail. Federal and state responses are listed here. It's a good start, but it's not enough, as evidenced by the number of deaths we continue to have. And I'm happy to share this with anybody. By the way, you can email me and I'll be happy to send it. One of the things I wanted to point out is in the midst of this, we actually had a funding reduction last year, for this year actually, of about $200,000. That means we serve fewer people in the midst of an epidemic. So protect yourselves and your loved ones. If you are having some kind of pain or you have surgery, if you can avoid using opioids or any kind of addictive medication, I recommend that you do so. I once had a physician try to give me 90 Valium. Valium are also addictive, very addictive, along with Xanax, Ativan, and I said, no thank you. Did you see where I work? No. So I recommend that you do that. Say no thank you, try ibuprofen, Aleve, whatever else might work for you. Talk about it with your kids, talk about it with your friends. This stuff is no joke, it's nothing to mess with. Treatment is available. Just real quick, medication-assisted treatment, that is not a replacement of one drug for another. People feel very emotional, very strongly about that. What it is a medication to help a person get through the hardest parts of what it is to deal with an addiction while they try to change their behavior and change the chemicals in their brain, and it takes some time to do that. So where can you get help? Locally here, of course, you can get help at Centerstone. You don't have to get help at Centerstone. You can go wherever you want, anywhere that there is an addiction service provider. You can get your loved ones help as well. If you want some tips, feel free to give us a call. We're here to do what we can. And I do want to give a shout out to our commission. Our county commissioners have been funding detox services in this county for as long as I have been employed at Centerstone, which is 21 years. And without that, our folks here in Manatee County would not be able to get detox because the state has not been funding it, and it does save people's lives. And I want to leave you with this message. Treatment really does work. This was all very depressing information, but there is hope. Treatment does work. If I didn't believe that, I would not continue doing my job. I would say, okay, I have to retire now, goodbye. So thank you for having me.
Thank you, Melissa. We have time for a couple questions. Jane?
Everyone asks that, and for 3 years I've said I have no idea. I can say that I think it's just happenstance to a certain extent. We did have a number of pill mills. Our local governments got together and enacted some legislation that shut them all down. The problem is that the pill mills created a market. They created their own market for opioids, and when they shut down, then there was a vacuum in the market. The drug cartels swooped in and said, hey, we can take care of that, everybody. And I think I don't have an answer. And I don't think anyone does. I don't think anyone's been able to give one. We have no idea. And I was going to say, it's so beautiful here, right? I torment my northern relatives with our winters every single day during the winter. And it's hard to believe. It's hard to fathom that we have this issue to the extent that we do.
In the back.
Yeah, Melissa, I'm wondering if you've seen any statistics involving states that have a medical marijuana program with opioid addiction rate versus states that don't have it. Is there a correlation there?
I don't think we have that data yet. I do know there are people looking at it. And there are people out there that are hoping that maybe medical marijuana is an answer, but I have never known a single person that started smoking marijuana or using marijuana after heroin or an opioid and stayed off of it forever. So I'm not sure, to be honest. We'll see. I think there will be research, though, so that'll be helpful. And any research we do to try to figure this out will be helpful. I would never agree with letting someone die because they have a disease. And we consider addiction a disease. It's been proven medically that it's a disease.
Okay.
And that's okay. That's okay. So they have passed laws. So there's a certain amount of producing this stuff that is illegal. The problem is the pharmaceutical companies make a lot of money. They give a lot of money. It's a huge business. People own stock in those businesses. Very powerful, influential people. So the likelihood of anyone powerful, influential saying, hey, you can't do that anymore, it takes money out of their pocket, is slim. But to a certain extent, that probably is part of the answer.
All right, let's give her one last round of applause. Hold on, Melissa. As a token of our appreciation, we'd like to give you our Kiwanis Golden Rule to help you measure the future success of your job at Centerstone. Thank you very much.
Thanks, Brett.
All right, before I turn the program back over to Ashton, I want to thank all of our guests for coming today, especially our Manatee High Key Club. If all those Key Clubbers could please stand up. You guys do a phenomenal job at Manatee High. I'm going to go ahead and let Ashton close it out.
So I just want to say thank you for having our club here, and it was really fun, and thank you all for coming out today, and have a nice rest of your day.